DHEC can enact emergency powers should a situation call for it, but do those powers apply to the increase of COVID-19 cases? News 19's Emily Correll joins us with those details.
Today, South Carolina has surpassed 750,000 cases of COVID-19.
Case numbers in South Carolina are climbing higher and higher as the Delta variant surges throughout the country. What more can be done to combat this? The South Carolina Department of Health and Environmental Control actually has a set of emergency powers it can use in times of crisis.
That emergency authority that was referenced allows DHEC to respond quickly, as we've discussed, I think, to local situations or outbreaks where rapid action is necessary. And steps can be taken to prevent immediate, imminent danger to the local population.
According to the Implementation of Emergency Health Powers Act, the regulation is intended to provide for timely recognition of sources or potential sources of disease, identification of victims or potential victims, delivery of health care, application or appropriate public health measures, and assurance of due process and personal privacy commensurate with the public health threat.
I don't think that there is one specific number threshold that we have, as we would have to take an entire situation into consideration and in context of a number of different factors. But those emergency powers that is what they are intended to be used for, is for when there's immediate danger to a local community.
For example, many are wondering why emergency powers haven't been enacted in school districts across the state, given the enormous amount of COVID-19 cases present.
The situation in all of our school districts across the state are different. Issuing a statewide order that applies equally to every school and that would be enforceable with the current proviso in place and that would withstand legal challenge is just not currently feasible.
I'm Emily Correll, News 19 WLTX.
And moving now to the latest numbers from DHEC as the health agency